Welcome back again. This is your Oncocare advisor and Dr. Raghu here. I want to talk about just some high-level information about the stage and what should be done to reduce the risk of recurrence and how do we follow or surveillance. Most stage 1 colon cancers generally treated with surgery alone. You generally do not need any form of chemotherapy. Stage 2, we actually divide that into two parts, high risk or not so high risk. In high risk patients, we do talk about giving chemotherapy to reduce the chance of recurrence. We might talk about 3 months versus 6 months of chemotherapy. In stage 2, not high risk, we might skip chemotherapy. Stage 3, definitely chemotherapy is needed for up to 6 months to reduce the chance of it coming back. And how do we know what the high risk means? There are several things we look at. We look at if there was any obstruction or perforation, meaning that did it make any hole in the colon? How did it look under the microscope? If it looked very aggressive or if it looked somewhat systematic. If there are any lymph nodes positive, if so, how many lymph nodes positive? All these different features give your doctor an indication about how long the treatment should be given and the type of chemotherapy as well as the reason behind that chemotherapy. And lastly, surveillance. Surveillance can be done in different ways. I usually classify it into 3 parts. If you've noticed, I like 3s. The first one is person. That means when we meet with the person, history and exam. That means talking to the person and understanding if they're having any symptoms and examining the person. Second is blood work. There's something called a tumor marker called CEA, which is a helpful marker to give some form of a direction to identify in case if the cancer is coming back. But it's not always helpful test, but we keep that in the back of our mind. Third is CT scans, meaning you may get CT scans every 3 months or every 4 months or every 6 months, depending on the time duration and the duration of that surveillance. Usually we don't do any scans after 5 years of surveillance. One more thing I want to add there is something called ctDNA, circulating tumor DNA. It's a newer test. I'm not sure if they're doing that in India yet, but that is a game changer as you move forward. Is that test will be very critical to identify the cancer coming back even before the scan shows any evidence of cancer. So, to summarize again, while stage is one part of it, staging gives us a sense of what is the risk of it coming back. So if so, depending on the stage, sometimes you need chemotherapy, sometimes you don't need chemotherapy. But what happens after that, the surveillance is a very critical part. Surveillance can include the person, the blood work, the scans, and more recently, ctDNA, which is a blood test. I hope this was helpful, and if you have any questions, comments, or any topic you want me to talk about, please let us know and we'll be happy to cover them. Thank you for your attention.